dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and today we're going to be talking about multiple sclerosis. My guest is Dr. Andrew Smith. He is a neurologist at Dartmouth, Hitchcock, Lebanon. Thank you for being with us today, Dr. Smith. We really appreciate it. We'd love you to just jump in and talk about what is multiple sclerosis.
Well, Yvonne, thank you very much for having me today. This is something I'm quite passionate about. Multiple sclerosis is an autoimmune disease which affects the brain and the spinal cord. So it's a disease in which the immune system, for reasons that we don't completely understand, causes inflammation within the brain and the spinal cord, leading to patients to have neurological symptoms and disability.
What are the common early signs of multiple sclerosis?
Sure. One of the most common first symptoms of multiple sclerosis are relapses, where patients have subacute onset, so symptoms that gradually occur over the course of hours to days. And one of the most common relapses is something called optic neuritis, in which a patient can lose vision in one eye or both eyes, and is accompanied by pain. Other frequent symptoms of relapses in MS include double vision, numbness on one side of the body, or weakness on one side of the body, or weakness in both legs.
And what does a person go through in order to be diagnosed with multiple sclerosis?
So frequently, patients are first seen by their primary care doctor or an ophthalmologist, which may trigger a referral to a neurologist, and then subsequently, usually patients then will have an MRI scan of their brain or their spinal cord, depending on their symptoms. And then MRI scans can frequently show characteristics which are typical of that seen in MS. Sometimes after that, spinal fluid testing, looking for evidence of inflammation that is quite common in MS, is done.
Mm-hmm. And can you get multiple sclerosis at any age?
So, yes. However, the most common age is in the late 20s, and usually it's more commonly in women than men, so about 2-to-1 ratio women to men. Certainly there are pediatric cases of multiple sclerosis, and then I certainly sometimes see patients who present in their 50s and 60s with symptoms consistent with multiple sclerosis. But by far and away, adolescent through 30 years of age is the most common presentation.
And how long can you live with multiple sclerosis?
So the age of a patient who with multiple sclerosis is only slightly reduced from the average population. So it's not a rapidly progressive neurological disease in most cases, and only has a minor impact on overall survival.
And I know some people refer to multiple sclerosis as MS. That's kind of an abbreviated word for it. Can it go away on its own?
So we certainly do see cases of patients who present with one relapse ever, so one episode of neurological symptoms that completely resolve, and then never have another relapse or other neurological symptom related to their MS. We certainly also see patients who have MRI scans obtained for different reasons other than symptoms characteristic for MS, including headache, on which we look at their MRI scan and it looks like MS, even though the patient has never had any symptoms related to that. And those patients frequently never have another attack or never have an attack or neurological symptoms related to that. So it's quite a variable disease.
And what are the stages of multiple sclerosis?
Yeah, so there are two primary forms of multiple sclerosis. The most common form of multiple sclerosis is something called relapsing multiple sclerosis. That's a stage of the disease that's most common early on in the disease, in which patients have acute onset or subacute onset of new neurological symptoms that come on over days and then may gradually improve to completely resolve over weeks to months. And then they can have new neurological symptoms down the road. The other form of multiple sclerosis is something called progressive multiple sclerosis. Some of those patients never have relapses. When they're diagnosed, they have gradual disability accumulation over the course of several years without relapses. Some patients with relapsing MS will convert over to a progressive form of MS several years after being diagnosed with relapsing MS.
And what is the treatment for MS?
So currently we have over a dozen different treatments for relapsing forms of MS, where those treatments are aimed at preventing future disability related to relapses. There is one FDA-approved treatment for primary progressive MS that was approved 1 year ago called ocrelizumab. And that has shown to reduce the amount of disability progression in patients with primary progressive MS.
And is it hereditary? Does it run in families?
So it's not hereditary in a sense of what we think of hereditary diseases, where, for example, a patient may have a 25 to 50% chance of developing the disease if one of their parents have the disease. And that's what we think about it being a hereditary disease, where it's either autosomal dominant or autosomal recessive. There is a higher risk of other family members developing MS that's higher than the baseline. So, for example, the overall prevalence of multiple sclerosis is probably in the range of 1 in 500 to 1 in 1,000. But if your mother or father had MS, your risk is about 3 times greater than the average population. But you're still much less likely not to develop MS. And then the other situation is with siblings. So siblings of a patient who has MS, they're about a 5 to 7 times greater risk of developing MS.
And when someone is going through the variety of relapse symptoms that you mentioned before, are there sometimes different symptoms that can occur later on? For instance, breathing problems, changes in emotional health, perhaps bladder and bowel dysfunction, or sometimes sexual dysfunction?
Right. So MS can cause multiple different symptoms for patients that we monitor on an appointment type of basis, and actually in follow-up on telephone calls as well. So those types of symptoms, the common symptoms are fatigue. So fatigue in MS is quite common. Patients with MS frequently have difficulties with heat intolerance. Cognitive difficulties can frequently occur and probably are under-recognized. Bladder issues are very common in both men and women. Sexual dysfunction can also occur. Depression is also very common in MS. So there's a whole host of symptoms related to the disease that we try to symptomatically treat.
Is there a potential for misdiagnosis with MS?
Absolutely, absolutely. I think there's a common perception that MS can cause anything, and so patients who may have some fatigue or symptoms that are not quite characteristic of MS frequently think they might have MS because they know a friend or a family member who may have MS. And so I frequently see patients who are concerned that they might have MS based on some of the symptoms that they may have. And certainly MRI scans can find changes in the brain that may look like MS, but that aren't necessarily typical of MS when I review the MRI scans.
And is there a difference between multiple sclerosis, MS, and fibromyalgia?
Yeah, so there is. There certainly is. We don't really completely understand fibromyalgia, but certainly a lot of patients with MS have fibromyalgia, but we're not certain that the MS is causing their fibromyalgia. So some patients do present with musculoskeletal pain. That's very typical of fibromyalgia, but we don't typically think of that as being a characteristic symptom of MS. Sometimes that musculoskeletal pain may actually, in patients with MS, may actually be spasms or muscle tightness, which is common in MS. So it's important to try to figure out exactly what those symptoms are.
Is there a way to slow the progression of MS?
So potentially. So there is some evidence that to suggest that earlier treatment of MS may have an impact on patients' disability down the road. So by reducing the number of relapses that a patient may have, they may change the course of their MS. That type of research is relatively new because we haven't had MS medications for very long. So the first MS medication was approved in 1993, and the more potent therapies have really only been available for the past decade. So I think we're a little bit early to know how especially our more potent therapies, how that changes the disease trajectory. I will say that with the trial in patients with primary progressive MS using ocrelizumab, is that they reduced the number of patients who had disability progression over time.
So what are the symptoms of MS in women? You had said that the majority are women that get it. You mentioned some symptoms before, but are there certain things that are directly related to the female patient, related to symptoms?
Yeah, so not necessarily. So the same type of relapses can occur in women as occur in men. I would say the one thing that may have more of an impact in some postmenopausal women is the heat intolerance can become more of an issue. Otherwise, the one thing that I always try to take into consideration in women when treating their MS is their plans of becoming pregnant, and which may have an impact on treatment of their disease and using different types of medication. And so we frequently talk about those plans and family planning on what medication they may want to be on.
And would it affect the baby in utero in any way, having MS?
So no, there's no significant impact necessarily on the baby during pregnancy. What is more of a concern is medications that the women may be on and those potential effects on the baby.
And is there
So
anything?
actually during pregnancy, there is frequently a reduced number of relapses in women, but in the postpartum, so after delivery, there can be a significant increase in relapses. So there is some hormonal connection there.
Any observation for the pediatric patient once the child is born that needs to be observed or really looked at based upon the mother having MS?
No, not necessarily. So babies born to moms who have MS, there's no significant differences between a mother who does not have MS. Other than, if they were on different medications that may put a higher risk on the baby.
Now, according to the Multiple Sclerosis Association, they've identified a small number of people that may have a particularly rapidly progressing form of MS. What does that look like, and what's the cause of that?
Yeah, so we don't know the cause We don't know the cause of MS in general, and we certainly don't understand the cause of more rapidly progressive forms of MS. But how that typically presents is typically related to gait impairment and functional ability, and going from walking to wheelchair to potentially being bedbound. Though those forms of very aggressive MS in regards to disability progression are relatively rare. There are forms of more aggressive relapses in which the patients actually recover relatively well from those relapses, but they may have several new lesions in the brain and the spinal cord. So this is a quite variable disease. I have patients who are bedbound, but I also have patients who run marathons or do triathlons. And so this disease affects patients quite variable from one patient to another. No one is the same.
Do you die, or can you die from MS, or do you die of something else?
Yeah, so it would be very uncommon to die from a disease of MS. More, what can happen is dying from secondary complications of MS. So in later stages of MS, when some patients who get to the point of being bedbound may have respiratory difficulties and can develop pneumonias from that. But by and large, that's relatively uncommon. So I have relatively few number of patients who get to the point where they're bedbound because of their MS.
And can you detect MS in a blood test?
No, currently there's no blood test available to detect MS. It's a clinical diagnosis based on patients and their presenting symptoms and findings on examination, and the use of MRI scans and sometimes spinal fluid testing.
Mm-hmm. And would you say, is multiple sclerosis a disability?
Yeah, it's certainly. It is a disability for a large number of patients. So it is one of the leading causes related to neurological diseases for unemployment and disability.
Okay. And as far as treatment of MS, what have you found in your experience works the best?
Right. So like I said, it's highly variable from
Yes.
patient to patient. And in my experience, it's important, I think, for patients to be on MS relapse reducing medications if they have risk for relapses, to try to reduce the risk for future disability associated with those relapses. I think it's quite important to tailor the treatment to the patient. Like I said, the disease is quite variable from patient to patient. I think it's important to diagnose patients early and pick up on cues that may increase, that shows that they have an increased risk of disability in the future, and to treat those patients more aggressively early on in the disease course, versus there are some patients who have milder forms of MS. I think that over-treating with medications may put those patients at higher risk of side effects and complications.
Now,
So I think it's important to tailor the treatment.
Of course, and you mentioned before that MS can be a disability. Does it entail a lot if someone is working and it in fact is a disability for them to get disability insurance or help with this?
So yeah, I frequently recommend that to patients, and I frequently also help patients in deciding or designing ways to allow them to continue to work. So in conversation with their employers and whatnot, and picking up different ways to keep them in work. Many of my patients continue to work, but certainly there are some patients who are no longer able to work, and I think that's important to do appropriate testing to document the difficulties that they're having, because they might not be visible.
Absolutely. And what are the best oral medications for MS?
So currently there are 3 oral medications available for the treatment of MS. Those would be Aubagio, Gilenya, and Tecfidera.
And
None of these medications have been tested against each other, so it's hard to comment on which one is best.
okay, from a nutritional point of view, are there particular foods that people should be eating as well as avoiding if they have MS?
Certainly. So this is an area where there's actually a little bit of a lack of scientific background to help us in guiding our patients. It's actually one of the most common questions that patients ask me. What we do know is that patients who are above their ideal body weight may be at a higher risk of relapses. There is an association, at least, with that. But as far as a specific diet, we don't really have a lot of data to suggest one specific diet may reduce the risk of disability. What I do recommend then to my patients is a cardiovascular heart healthy diet, because there is an association with cardiovascular risk factors such as high blood pressure and maybe a slightly higher risk of disability.
So based upon that particular diet, what would be included in that?
So lower in red meats, higher in vegetables and fruits, that type of diet.
Mm-hmm. And what are resources available for patients as well as their families to support them?
Sure. So you've already mentioned the Multiple Sclerosis Association of America, so MSAA. Another great resource is the National MS Society. They have, both associations have great information for patients and their families, as well as resources for them to contact for information on as far as social work type of issues in regards to employment and medications. There's also local chapters of the National MS Society that meet on a regular basis. For some patients, that's a great opportunity for support and asking questions. And frequently they bring in an MS expert to give a talk on a specific topic.
And at Dartmouth Medical Center in Lebanon, are there some special things that you're doing there with multiple sclerosis patients?
Certainly. So there are a few things going on. So in collaboration with one of the neuropsychologists here, Dr. Heather Wishart, she is doing some brain MRI scan research. We are frequently involved in clinical trials that are going on, and we are involved in some at this point in time. And I've been here since July. So I am in the process of getting different research projects up and going as well.
All right then. So from an overview point of view, what would you want people to know about MS, the most important things that they should be aware of?
Certainly. So first off is multiple sclerosis is not a rare disease, and it is a relatively common disease. And it primarily affects patients who are in the 20s to 40s, women a little bit more than men. Another important takeaway is that I think it's important for early diagnosis and treatment and recognition of common symptoms of MS, which I think are most important for the primary care doctors and general neurologists when they're seeing patients who present with those symptoms for early recognition. And
Could you review those symptoms? Could you review those symptoms?
So it's typically onset of symptoms over the course of hours to days, and those symptoms most commonly are loss of vision in one or both eyes, double vision, numbness on one side of the body, or weakness on one side of the body, or numbness and weakness in both legs.
Okay.
So those are the most common relapses.
Okay, and the importance is to get treatment early.
Yeah, I think there is an importance on recognizing the symptoms and getting the diagnosis early to start treatments that reduce the risk of future relapses and associated disability.
So patients need to go to their primary care providers if they notice any of the symptoms that you've described and immediately be seen and let them know what's going on. And is it at that time that they then refer them to a neurologist such as yourself?
Yeah, that's frequently the case. That's frequently the case if there is concern. And certainly if, when the primary care doctor feels that an MRI scan is warranted based on the presentation of symptoms and their examination, then an MRI should be obtained. Then that will certainly help guide the neurologist who then sees the patient.
So someone that is diagnosed with MS, what would you say to them?
So I frequently say multiple different things. So I frequently start by telling patients that this disease is quite variable, and that some patients have significant disability, while a large number of patients have minimal disability related to this disease. And so sometimes patients are frequently very concerned that they, down the road won't be able to walk and will be bedridden. And I try to reassure or give them some optimism about the disease, to say that isn't always the case. That we need, certainly we need to address the disease and start treatments to reduce that risk.
And as far as resources available, where can they go online to learn more about MS and also to connect out for further help?
Yeah, so like I said, the National MS Society website is a great resource for patients. It has a patient section and actually goes over common symptoms of relapses for patients, and also talks about medications that are available for the treatment. The Multiple Sclerosis Association of America also has great resources for patients as well. Those are the primary sites, yeah.
All right then. Well, Dr. Andrew Smith, it has been a pleasure to have you on the show. This has been very informative, and I thank you very much for all that you do to support people in the field that you're in. We greatly appreciate it. Until next time.
Thank you for having me.
Thank you.
The preceding program